Hello everyone, I'm Dr. Suyash Kulkarni, and today we are going to discuss a little bit about ways to decrease your blood pressure without taking medicines. Yes, you heard it right. Without. Well, I'm a physician, but yet I'm going to give you the tips which everyone may not. So, let's begin. First, lose that extra weight which you're carrying about. Please understand that extra weight is the thing which is keeping your blood pressure from getting under control. For every 1 kilo you lose, you decrease your blood pressure by approximately 1 millimeter of mercury. Now, the important aspect is not only reduction of weight, but also reduction of the waistline. In men, your waistline should be less than 40 centimeters, and in females, it should be less than 35 centimeters. Second, exercise. Well, you have to exercise approximately 150 minutes per week. So, on an average, maybe 30 minutes per day, 5 times in a week. Avoid overstraining or doing all the exercise in one day. Because please understand, you cannot eat 1 week's food in a day. So, neither can you do your exercise of 1 week in one day. So, regulate it. Do an exercise of 30 minutes per day, 5 times a week. By doing this, your blood pressure can decrease by around 5 to 8 millimeters of mercury. Important aspect, if you stop your exercise, your blood pressure goes up again. Now, regarding diet, well, you have to consume fruits, pulses, whole grains. Important aspect is cut down on the fat content in the dairy, so have a low fat free diet. Important aspect is have a DASH diet. Now, what is a DASH diet? Well, it's the dietary approach to stop hypertension. This is available all across on Google and on website, so you'll be able to find it anywhere. Next, you have to consider decreasing your salt intake in your food. So, what do we do? Well, 1 teaspoon of salt approximates to around say 2000 to 2500 milligrams of sodium. If you have blood pressure and if you need to cut down, you have to consume salt of around less than 1500 milligrams in a day. 1 teaspoon of salt can create problems. So, how do you go about? Well, avoid processed food. Second, whenever you are buying anything from the market, check the sodium content. Third, use low salt in your diet. So that is if you are having salads or anything else, avoid it. Do not take salt on your cucumber, your tomatoes. Just avoid it altogether. Next, you have to consider quitting smoking. There is no option of decreasing smoking per se. You have to quit smoking if you are intending to control your blood pressure. Next, you have to limit your alcohol intake. Your alcohol intake is the one which will decrease or increase the blood pressure, irrespective of whether it is in moderation or not. So you have to decrease the alcohol content, limit it, or else stop it. Now, another important aspect here is the coffee. Now, all the coffee drinkers are going to hate me for saying this, but you have to consider decreasing your coffee intake or stopping your coffee intake. You might be reactive to it. So how would you come to know that you are having problems with your coffee? Well, 30 minutes after you have a caffeinated drink, check your blood pressure. If your blood pressure has gone up by more than 5 to 10 millimeters of mercury, that means you are reactive to this caffeine. Then you may need to strictly consider decreasing or stopping your coffee products. Next, reduce your stress. So stress can be multifold. Physical, mental, emotional. You have to understand and deal with whatever the problems you're facing with. Next, support. You need good support from your family members. If you are a hypertensive patient, your family has to support you. They can't sit in front of you, eat papads and eat pickles. So they also have to make some sort of sacrifices. So you need a good support if you are going to consider getting the control of your blood pressure. And finally, check your blood pressure on regular basis. Nowadays, automatic machines are available in the market. I'm not going to name any companies, but you have multifold, available equipments. Get one at home, check your BP, and jot it down. Make a diary. With this, approach your doctor. He or she will be able to help you control your blood pressure. Well, if you have any other queries regarding blood pressure, please feel free to contact me. Thank you.